Number 3, SB 958 by Senator Lamone. Consultant, please call out the absent members.
Melendez, Gonzalez, Grove, Hurtado. Hurtado, aye.
Okay, that bill is currently 8-0. We'll put the bill back on call for absent members. Next item is item number... Next bill is item number 4, SB 1019 by Senator Gonzalez. Consultant, please lift the call. Please call out the absent members.
This is on SB 1019.
1019, right.
Melendez.
Oh, sorry. We're lifting calls, so it's, again, it's item number 4.
All right. Melendez, aye.
Melendez, aye. Gonzalez, Grove, Hurtado. Hurtado, aye. Rubio.
Aye.
Rubio, aye.
Okay, that bill currently has 9-0. We'll put the bill back on call for absent members. Next item is item number 6, SB 1035 by Senator Eggman. Consultant, please call out the absent members.
Melendez.
Aye.
Melendez, aye. Gonzalez, Grove, Hurtado. Hurtado, aye. Rubio.
Aye.
Rubio, aye. Wiener.
Okay, that bill is currently 8-0. I'll put the bill back on call. Let's do item number 7, SB 1227 by Senator Eggman. Consultant, please call the roll of absent members.
Melendez.
Aye.
Melendez, aye. Gonzalez, Grove, Hurtado.
Aye.
Hurtado, aye. Rubio.
Aye.
Rubio, aye.
Okay, so that's currently 9-0. We'll put the bill back on call. Let's now move on to item number 8, SB 1142 by Senator Caballero and Skinner. Consultant, please call out the roll of absent members.
Gonzalez, Grove, Hurtado, Limon.
Okay, so that bill still is currently 6-1, and we'll put the bill back on call for absent members. We're still waiting for Senator Kamlager to hear item number 9.
Could I add on, sorry, to number 6, 1035?
Okay, actually, let me go finish and then we'll come back to that
Okay,
one.
sorry.
We're almost there. All right, and then let's move on to item number 10, SB 1419 by Senator Becker. Consultant, please call out the roll of absent members.
Melendez.
No.
Melendez, no. Gonzalez, Grove, Limon, Wiener.
Aye.
Wiener, aye.
Okay, that bill is currently 7-1, and put the bill back on call. Then move to item number 11, SB 1475 by Senator Glazier. Consultant, please call out the roll of absent members.
Melendez.
Aye.
Melendez, aye. Gonzalez, Grove, Limon.
Okay, that bill is currently 7-1. We'll put the bill back on call. And actually, which one's for Senator Wiener? Senator Wiener?
1035.
Hold on. All right, we're now going to go back to item number 6, SB 1035 by Senator Eggman. We're going to lift the call again on item number 6, SB 1035 by Senator Eggman. Consultant, please call out the roll of absent members.
Gonzalez, Grove, Wiener.
Aye.
Wiener, aye.
Okay, that bill is currently 9-0. We'll put the bill back on call. All right, so I guess at this point we're waiting for Senator Kamlager, who I know is also in another committee. So. Oh, yes, hold on. So, yes, we do have the consent calendar. Sorry. Okay, so let's lift the call on the consent calendar. The consent calendar is only one item, item number 5, SB 1023. Consultant, please call out the roll of absent members for the consent calendar.
Melendez. Melendez, aye. Gonzalez, Grove, Hurtado. Hurtado, aye. Rubio. Rubio, aye.
Okay, that's currently 9-0. Put the consent calendar back on call for the absent member. Okay. She's here. Sarah Kamlager, welcome. So we are on item number 9, SB 1245. Welcome.
Thank you.
Apologies, members and Mr. Chair, but I'm happy to be here. And I thank you for your patience. I am here today to present SB 1245, the LA County Abortion Access Safe Haven Pilot Program. Senate Bill 1245 will support a funded pilot program for Los Angeles County to build on the statewide efforts to advance California as a reproductive freedom state. The program will house innovative approaches and patient-centered collaborations to safeguard access to abortion for patients coming to Los Angeles County, regardless of where a patient resides. This year, the United States Supreme Court is reviewing a direct challenge to the constitutional right to abortion established in Roe v. Wade. Should the court uphold Mississippi's ban, thereby overturning Roe, thank you, Senator Eggman, people in over half of the states in the country, over 36 million women, and other people who may become pregnant will lose access to abortion care. It is already happening. People in Texas have been denied protections under Roe since the state's extreme abortion ban went into effect last year. According to a report released by the Guttmacher Institute, the number of out-of-state patients who would find their nearest abortion provider in California from 46,000 to 1.4 million, an increase of nearly 3,000%. LA County accounts for over a third of all abortions that take place in California. The prevalence of abortion in Los Angeles County in particular likely reflects better access in the city than other parts of California and even other states in the nation. This prevalence, coupled with the county's role as a major metropolis transportation hub with multiple airports, makes it highly likely that non-residents will come to Los Angeles County for the abortion care that they will not be able to access in their home state or county. Currently, LA County has already made evident commitments to health equity. The county has a record of successful innovations in care coordination through programs such as My Mental Health, LA eConsult Systems, Lane's Health Information Exchange, and the Whole Person Care pilot programs, which are now informing CalAIM's statewide efforts. Building upon the LA County's Board of Supervisors resolution of building a countywide response to the potential overturn of Roe v. Wade, SB 1245 would fund and support a pilot program approach to care that is responsive to the impending needs of people seeking abortion care. Key funding areas for the pilot program will include services that prioritize efforts to advance and improve health outcomes, comprehensive sexual and reproductive health services, streamlined and secure infrastructure to coordinate care and other patient support services, patient access tools to empower patients to overcome barriers to care, medically accurate education and training tools specific to community needs within the county, and patient and community outreach to assess county services. With abortion rights already eroding in numerous states, and the future of Roe v. Wade hanging in the balance, now is the time to put forward innovative investments in abortion access. With me here in support is Selena Vasquez, Chief External Officer from Planned Parenthood Los Angeles, and Anyama Obika, Policy Analyst from Black Women for Wellness Action Project. And at the appropriate time, I will respectfully ask for your aye vote.
Right, thank you so much, Senator Kamlager, and I believe both are going to be joining us by phone. So, Moderator, please bring onto the line Selena Vasquez from Planned Parenthood Los Angeles and Anyama Obika from Black Women for Wellness Action Project. I guess we'll begin with Selena Vasquez. You each have 2 minutes, total 4 minutes together. So, Vasquez, if you go over, that's going to be time away from the second witness. So, Selena Vasquez, please begin.
Thank you. Good afternoon, almost evening, Chair and members. This is Selena Vasquez. I'm the Chief External Affairs Officer for Planned Parenthood Los Angeles, and we proudly take care of Los Angeles County residents, over 225,000 visits per year. This year alone, we have seen 500 abortion restrictions introduced in 41 states, with 3 abortion bans being recently enacted in Arizona, Idaho, and Wyoming. In other states like Missouri, lawmakers are taking an even more aggressive approach, attempting to ban residents, attempting to ban residents from leaving the state to obtain an abortion. And it is estimated that in the next few months, over 36 million people, folks in over half of the states in our country, will lose access to abortion in their home state. Los Angeles County is home to almost 30% of the state's population and accounts for over a third of all of the abortions that do take place in California. This fact, coupled with the county's role as a major metropolitan, as the senator stated, transportation hub with multiple airports, makes it highly likely that non-residents will come to Los Angeles County for abortion services that they simply cannot access in their homes. At Planned Parenthood Los Angeles, we've seen an increase in number of patients traveling to us from out of state, in particular Texas patients. In fact, one has even traveled by way of Uber. It's a difficult time for patients. It is a difficult time for abortion access, and we are preparing for the influx of patients coming to other states, to California and Los Angeles. The bill before you today will ensure that Los Angeles County is prepared, is starting to even further commit to their commitment for their board motion in January
2 minutes.
to be that reproductive health care haven. Am I over time? Excuse me.
Yes, you're eating into the next witness's time.
I will respectfully allow my colleague, give my time to my colleague. I just respectfully urge an aye vote on this critical bill at this very dire time. Thank you so much.
Thank you. Let's now move on to Anyama Obika from the Black Women Wellness Action Project. You have 1 minute 45 seconds.
Good afternoon, Mr. Chair and committee. Thank you, and thank you for sending that. I'm Anyama Obika with Black Women's Wellness. We're a reproductive justice community-based organization committed to improving the overall health status and well-being of Black women and girls. We have offices in LA and Stockton, and I'm here to express our strong support for SB 1245. This bill will affirm our state's commitment to reproductive freedom and advance its efforts to protect, expand, and make equitable access to the full spectrum of reproductive and sexual health care, including abortion, by supporting its largest county's efforts to do just that, to do the same thing. As we've heard, we're witnessing a concerted effort to dramatically roll back reproductive rights across the country. And while California is unapologetically affirms an individual's reproductive rights, the reality is that many people of color, particularly Black and Indigenous communities, lack tangible access to the wraparound reproductive and sexual health care services and resources necessary to make the best decisions for ourselves and our families. Additionally, I'd like to highlight that at the same time, in this moment, racial disparities in maternal health outcomes are widening due to the effects of structural racism and implicit bias, among many other factors. In LA County, Black working people are over 4 times more likely to die from pregnancy-related causes. So ensuring access to the full spectrum of reproductive and sexual health care, including abortion, is particularly important to our community. Black working people should not only be able to decide whether or not to continue a pregnancy, but should also enjoy access to the care and resources that support us in doing so. Holistic, innovative approaches are necessary to address the growing inequities in reproductive and sexual health outcomes that BIPOC communities endure, and a coordinated approach is necessary to prepare for the increased care and support needed in the coming months.
Please wrap up.
Increasingly hostile landscape. LA County is making efforts to do just that, and based
Please
on
conclude.
collaborations with diverse stakeholders,
Please conclude.
positioned to respond to this crisis
Thank
in a
you.
meaningful and equitable
Thank you.
way.
Thank you so very much. You're over time. I apologize, but you're over time. Thank you so very much for your testimony. We'll now take any additional testimony from people who are here in room 1200, name, organization, position. Seeing no one approaching the microphone, we're now going to go to the telephonic line. Moderator, please open the lines for witnesses who wish to testify in support of SB 1245, name, organization, and position.
Thank you. If you wish to speak in support
hold on.
of SB
Before we begin, there is one person who's approached here in room 1200. Yes.
Sorry, Molly Robeson, Planned Parenthood Affiliates of California. We're a co-sponsor and support. Thank you.
Okay, thank you. All right. I apologize, moderator. We're going to go back to telephonic line, so hopefully everyone's hanging in there. Again, witnesses in support of SB 1245, name, organization, position only. I apologize, moderator, but please open the lines to those who wish to testify in support.
Thank you. If you wish to speak in support of SB 1245, please press 1, then 0 at this time. Line 452, please go ahead.
Mr. Chair and members, this is Erin Evans on behalf of NARAL Pro-Choice California and the Certified Nurse Midwives Association in support. Thank you.
Thank you. Next witness.
Thank you. Line 446, please go ahead.
I'm Xochitl Ayala with California's Only Abortion Fund, Access Reproductive Justice, and we're in full support of SB 1245. Thank you.
Thank you. Next witness.
Thank you. I have no further comments. Thank you.
Okay, thank you very much. We'll now move on to witnesses in opposition to SB 1245. We have two witnesses registered for testimony, Susan Arnall from the Right to Life League, come back, and then also Regina Avides from the Archdiocese of Los Angeles. So again, you have 2 minutes. If you go over, it takes away time from the second witness, total 4 minutes. Welcome.
My name is Susan Arnall. As I've told you before, I'm a California attorney. I'm with the Right to Life League. We are based in Los Angeles. SB 1245, although facially neutral, will disparately impact minorities. As the bill itself states, it is home to 28% of the state's population, but Los Angeles County already accounts for more than 1/3 of all abortions in California. Most abortion facilities in LA County are low-income, high-minority areas, and Guttmacher Institute statistics show that blacks and Hispanics are far more likely than any other race or ethnicity to have an abortion. We as a nation cannot and should not ignore racism in our history. Planned Parenthood's founder, Margaret Sanger, was an admitted white supremacist. Her stated purpose was to promote birth control and abortion for low-income people of color. Sanger referred to black Americans, immigrants, and indigenous Americans, and I quote, as human beings who never should have been born. I am not saying, and I do not intend to imply, that the authors of pro-abort bills traveling through our legislature are racist or intentionally promoting a racist agenda. However, by placing more abortion facilities in low-income neighborhoods in Los Angeles County, SB 1245 undeniably follows Planned Parenthood's eugenic roots. Margaret Sanger would be thrilled. Moreover, just like SB 1142, SB 1245 is one-sided in its funding, and its unequal financial support of abortion over childbirth is unconstitutional pursuant to the 1981 case Committee to Defend Reproductive Rights versus Myers. Thank you. Please oppose this bill.
Thank you. We'll now move on to Regina Avides from the Archdiocese of Los Angeles on the phone line. So, moderator, please bring her on and let her begin.
Good afternoon, Chairman Fan and members of the Health Committee. My name is Regina Avides. I'm a resident of South Los Angeles and a mother of a 1-year-old. SB 1245 is not what my community needs. Women in my community want to be moms. Yes, some of us might need a little extra help because we want to work, continue school, to provide a better future for our children. Yet our state keeps pushing abortion in our community as if this would help us. What we need is affordable housing and a state-funded child care, not more abortion infrastructure. Our county has more than 5,000 pregnant women experiencing homelessness, 38,000 children in foster care, thousands of struggling families. That's what we need help with. California is failing the women in my community. We are telling women we don't want to invest in people to accompany you or offer you resources other than abortion. My experience in Los Angeles is that abortion does not offer solutions. 60% of women who get abortions already have children. After the abortion, she returns to the same living conditions or living on the street. She returns to the same abusive partner or still living in poverty, and that's not the solution we want. It's not fair to offer abortion as the only solution for women. Pushing unwanted abortion in our communities amounts to coercion. Each expecting mother is strong, capable, and deserves the utmost support so that she and her child can rise together. Our neighborhoods have abortion providers that will go up to 9 months for free from dozens of providers and via telehealth. We don't need more abortion access. What we need is help with the basic necessities for us to survive and thrive. Our immigrant communities, low-income women, and women of color deserve empowering, nonviolent solutions to the problems we face. For these reasons, I ask a no vote on SB 1245. Thank you.
Thank you. We'll now take additional witnesses in opposition and to SB 1245 here in room 1200. Name, organization, and position.
Yes, my name is Sandra Ephraimson. I also represent the people of California. I extremely oppose this murderous bill.
Thank you.
Molly Sheehan with the California Catholic Conference in opposition. Thank you.
Thank you.
Jennifer Milborn with Abortion Survivors Network. I survived my birth mom's abortion attempt. I oppose this bill.
Thank you.
Greg Burr with the California Family Council in opposition.
Thank you.
Oscar Soriano from Richmond, California, and I strongly oppose this bill, and I hope you can do the same. Thank you.
Thank you.
Manny Muniz, and I oppose this bill.
Thank you.
Cheyenne Kenny, I oppose this bill.
Thank you.
Lauren LeBeau, I oppose this bill.
Thank you.
Elizabeth Kenny, I oppose this bill.
Thank you.
Jonathan Keller with California Family Alliance and the California Southern Baptist Convention opposing the bill.
Thank you. Seeing no one else at the microphone here in room 1200, moderator, please open the lines for witnesses who wish to testify in opposition to SB 1245. Name, organization, and position only.
Thank you. If you wish to speak in opposition to SB 1245, please press 1, then 0 at this time. Line 461, please go ahead.
Yes. Can you hear me?
Yes. Name, organization, position.
Oh. Yes. My name is Sandra Marquez. I am a Placer County resident and member of Placer County Freedom Coalition, and we strongly oppose this bill.
Thank you. Next witness.
Susan Bronner.
Thank you. Line 297, please go ahead.
Hi, this is Naomi Hopelin again, mother of two from San Bernardino County, and it is murder. I strongly oppose SB 1245.
Thank you. Next witness.
Thank you. Line 85, please go ahead. Line 85. Line 232, please go ahead.
Can you hear me?
Yes. Name, organization, position.
Hello?
Please introduce yourself.
Mr. Moreno, Alameda County.
And you're opposed?
I oppose this, you guys throw away.
Thank you. Thank you. Next witness.
Thank you. Line 457, please go ahead. Line 457.
Is that me?
Yes, please go ahead.
Bobby Hazelton, Big Bear City, aborted twice, adopted 3 kids. I vote no.
Thank you. Next witness.
Line 460, please go ahead.
Yeah, my name is Noah Milborn. I'm a father and a husband, a member of the Caring for Mothers and Unborn Babies movement. Strongly oppose this.
Thank you. Next witness.
Line 331, please go ahead. Line 331.
Yes, this is Susan Leahy, and as someone who would like more people of color in this world, I oppose this bill.
Thank you. Next witness.
Thank you. Line 380, please go ahead. Line 380.
Hello?
Yes, go ahead.
Thank you. Sorry I didn't get a number. My name is Robert J. Bird. I'm a lifelong resident of Senate District 11, hello Senator Wiener, and I am an activist at Pro-Life San Francisco and for justice. Vote no on SB 1245.
Thank you. Next witness.
Thank you. Line 466, please go ahead.
Penny Harrington from San Diego County in strong opposition.
Thank you. Next witness.
Thank you. Line 232, please go ahead. Line 232. I have no further comments. Thank you.
Okay, thank you. We'll bring it back to the committee. Questions and comments from committee members? Okay. Senator Grove.
Thank you, Mr. Chair. First, I do agree with the comments of the first individual in opposition that, Margaret Sanger, we've learned for years that she was a white supremacist, and she did put these abortion clinics in black and brown neighborhoods. I just want to make a statement. I know you guys are going to pass this bill out with flying colors, but there's no lack of access for abortions in Los Angeles, nor is there lack of access in California. The state already funds abortions through tax dollars. There's over 400 facilities performing abortions. Abortions are offered by nurse practitioners, nurse midwives, physician's assistants, via telehealth, on college campuses, and through dozens of sources by mail. And to do a pilot program like this, to use additional taxpayer dollars for out-of-state residents is, I would say, a slap in the face to California taxpayers that are obviously overtaxed as it is because of the abundant amount of surplus that we have. And I think it's an inefficient use of our resources, not only for the fiscal piece, but the moral ground piece. So thank you.
Thank you. Senator Tato.
Thank you, Mr. Chair. I just want to, I know that the conversation here today around this bill is largely focused on the abortion component, which, I think no one should have any say over a woman's body. That the woman should have a say over her own body. And second, the other component of the bill that I really appreciate is the increase, improving access to the full spectrum of sexual and reproductive health. I mean, look, we're coming out of a pandemic. We're still in one, right? And we know that a lot of people engaged in activity that are now, we have an increase in gonorrhea, an increase in syphilis. We have just a need for improving access to reproductive care as well. And so I know the focus has been on the abortion piece, but we got to look at it as a whole. And I think this bill will help with some of those issues that we'll be continuing to face. So I support the bill, and we'll move it at the appropriate moment.
Okay, it's been moved by Senator Tato. Any other questions or comments from committee members? Senator Eggman.
Thank you very much, Senator Kamlager, for bringing this forward. And if somebody on this dais has tried to access an abortion in the most recent history, then I guess they can with veracity claim that there is no problem with access. On an earlier bill today, we heard a very clear problem with access that somebody had in Los Angeles. So let's just say that. And I appreciate a lot of what people, as we said, this is an issue of choice and access. And for people who are opposing, to oppose on taking away somebody else's choice seems to be then imposing their feelings onto other people, which is against most of the things people stand up for, right? Freedom of choice, self-determination, those kinds of things, which this bill is trying to provide for people. You can't have self-determination if there is no access. That's like saying that nobody's hungry in California because we grow all this food, right? We know that's not true. We know even though we are a rich agricultural state, we still have people who suffer from food insecurity. So I would have moved the bill if it wasn't already. And I always hear in my mind the words of Dolores Huerta, who says, just because I had 11 kids doesn't mean I think everybody else has to. That was my choice. So anyway, thank you.
Thank you. Senator Melendez.
Thank you, Mr. Chairman. So your bill says funds may be used for the purpose of implementing recommendations from Los Angeles County, including but not limited to, and then it lists 6 different things here. So it's the not limited to part that concerns me, because that's basically open-ended. That means this money can be spent on anything. that the LA County Board of Supervisors decides is appropriate, that perhaps the taxpayers might not. So for instance, when you talk here in your bill about building secure infrastructure, can you define what you mean by that?
Well, sure. We know that there are attacks made against people who work in clinics and facilities where abortions are accessible. And part of it is about making sure that patients and clinicians are safe when they are going to seek care. It could be abortion care. It could be reproductive health care on the spectrum.
So what you're describing there is building a facility that is secure, much like the one we're in right now. Is that correct?
So that would be open to your point, the partnership between the Board of Supervisors and Planned Parenthood Los Angeles and the community where the pilot program is going to reside.
Okay. Countering misinformation campaigns, what does that mean? What misinformation campaigns are we talking about?
Oh, well, we know historically there's propaganda against clinics that offer abortion care or access to abortion care, doctors that
Is it
provide
propaganda
services.
or is it a different point of view?
Well, it's misinformation. If you say that X or Y could happen if you go into that clinic, that is misinformation.
Okay, well, that's open to interpretation. Providing medically accurate information to healthcare providers and patients. Providing medically accurate education and training tools to the community. What does that look like to you? Providing medically accurate education and training tools to the community.
It looks like, in a culturally appropriate and sensitive way, making sure that community members have access to accurate information relative to how they live, how they love, how they have sex, how they take care of their bodies, how they ensure that they are healthy.
But we don't have that already?
In some instances, we don't. Some communities may have an overabundance of those resources. Other communities may not, or it may not be consistent. For example, we do not have consistent access to care on our school campuses for K through 12 students. Some communities that might have an abundance of private schools or highly resourced school districts might have access to certain care that other districts may not.
So your bill then would allow funding to be funneled into the schools for the purposes of providing adequate education on attaining an abortion?
I was using an example about inconsistency as it relates to access. This is about a pilot program for abortion access and reproductive health care, not on a school campus.
Well, but I guess that goes back to my original question because in the bill it says, but not limited to, so the funds could be used to send either materials or personnel or, training videos or, whatever the case may be into the schools in order to educate kids about abortion or how to get it or what's medically, right? Because it says, but not limited to.
Well, not limited to could include a whole bunch of things like creating materials to tell you how you can go to Mars. But I would posit that that's not something that is within the scope of this particular bill. It could include, yes, a partnership with the Board of Supervisors and Planned Parenthood to, let's go with your example, to provide access to materials that talk about STDs, gonorrhea, syphilis, which is on the rise. That could also talk about depression and anxiety, also on the rise. We know that.
But your bill doesn't talk about depression and anxiety or syphilis. It talks about abortion. It says, in the very first paragraph of your bill, it talks about including the fundamental right to choose to bear a child or to choose to obtain an abortion. So this bill isn't about STDs or anything else. This bill is specifically about abortion.
So it's about comprehensive sexual and reproductive health care access, including abortion.
I just trying to understand the 5 or 6 points, that you have enumerated in your bill what exactly they mean. I think you've provided me some great insight today as to what you envision that to look like. I just wanted clarity on that.
Well,
and I thank you for your candor and your honesty.
So it will include access to sexual and reproductive health care access and services, including abortion. I'm not going to shy away from the fact that this is also about making sure that women, if they choose, have access to abortion services.
Thank you.
Any other comments or questions, committee members? Okay, I don't see any. All right. Senator Kamlager, thank you for bringing this bill forward. I think as you presented, there's a need to ensure in actually in the city that you at least represent part of in your district, the resources to be sure we have equal access. Would you like to close?
Thank you, Mr. Chair. I want to, in my close, respond to a couple of things. Yes, in fact, there was an opinion piece in the New York Times, I believe it was April of 2021, written by Alexis McGill, who is the executive director for Planned Parenthood, who talked about Margaret Sanger and does not excuse the history of her. And in fact, she was not against black people and brown people. She was also against other immigrants, Polish and Irish. And I also am not excusing her. I think she was a product of her time. I think it's also important to note that women of all colors, ethnicities, and races are having abortion, are getting abortions each and every day. Women have a right to choose what they want to do with their bodies. And this is a bill about making sure that women have a right to access the resources that they need based on the choices that they make. When we had COVID, the state of California said we have an obligation to make sure that we are getting testing and vaccinations to low-income communities, to make sure that black and brown communities have access to these resources because they've been disproportionately impacted from having under-resourced healthcare facilities in their community. And then we saw numbers of articles and TV reports of white people in black and brown communities in line getting those tests and getting those vaccination shots. I'm saying that because regardless of where something is located, people who need the resource will make their way to that facility. I also want to add that ultimately at the end of the day, it's not so much, it's about making sure that you have access to care. And it is also being very clear about what is happening in this country. Women from other countries and from states across this country are making their way to California to find access to care that is being denied in their state. Afghan refugees assaulted and raped by the Taliban who find their way to Texas, pregnant, wanting an abortion, are making their way to California. Latina immigrants living on the border in Texas, not able to access abortion care because there is a lack of clinics and physicians and safe, affordable access to abortion care, are making their way to California to receive resources. If we are going to uphold the declaration of the governor that says this will be a reproductive freedom state, we have a responsibility to make sure we can own up to that declaration by making sure that folks within California have access to the care that they deserve and want, and to make sure that we are not throwing them or marginalizing them, because we are also working very hard to address the needs of thousands of women each and every day who are desperately finding their way here. At the end of the day, regardless of if you pass this bill or not, people will continue to have sex. People will continue to get pregnant. People will continue to make decisions about what is right for their body, and people will continue to have abortions. We can create a scenario where folks are having illegal, unsafe, deadly, fatal abortions, or we can create a space where women do not have to die. With that, I respectfully ask for your aye vote.
Thank you, Senator Kamlager. The motion is do pass and re-refer to the Committee on Judiciary. It's been seconded by Senator Hurtado. Consultant, please call the roll.
Han.
Aye.
Han, aye. Melendez.
No.
Melendez, no. Eggman. Eggman, aye. Gonzalez. Grove.
No.
Grove, no. Hurtado.
Aye.
Hurtado, aye. Leyva. Leyva, aye. Limon. Limon, aye. Roth.
Aye.
Roth, aye. Rubio. Rubio, aye. Weiner. Weiner, aye.
Okay, that bill is 8-2. That bill is out. All right, so we're now going to go back and lift the calls. Well, I think it's probably best just to go back through the file order. Actually, maybe I'll just start off with the consent calendar so I don't forget it. First, we're going to begin with the consent calendar. And the only item in the consent calendar is item number 5, SB 1023 by Senator Hurtado. Consultant, please call the roll of absent members for the consent calendar.
Gonzalez. Grove.
Aye.
Grove, aye.
Okay, consent calendar is out 10-0. All right, now we're going to move on to item number 2, SB 923 by Senator Weiner. Consultant, please call the roll of absent members.
Gonzalez. Grove.
No.
Grove, no.
Okay, that bill is out 8-2. Next item is item number 3, SB 958 by Senator Limon. Consultant, please call out the roll of absent members.
Melendez. Gonzalez. Grove.
Okay, that bill is out 8-0. Next item is item number 4, SB 1019 by Senator Gonzalez. Consultant, please call out the roll of absent members.
Gonzalez. Grove.
Aye.
Grove, aye.
That bill is out 10-0. Next item is item number 6, SB 1035 by Senator Eggman. Consultant, please call the roll of absent members.
Gonzalez. Grove.
Aye.
Grove, aye.
That bill is out 10-0. Next item is item number 7, SB 1227 by Senator Eggman. Consultant, please call the roll of absent members.
Gonzalez. Grove.
Aye.
Grove, aye.
That bill is out 10-0. Next item is item number 8, SB 1142 by Senator Caballero. Consultant, please call the roll of absent members.
Gonzalez. Grove.
No.
Grove, no. Hurtado. Limon.
Aye.
Limon, aye.
That bill is out 7-2. Next item is item number 10, SB 1419 by Senator Becker. Consultant, please call the roll of absent members.
Gonzalez. Grove.
No.
Grove, no. Limon.
Aye.
Limon, aye.
That bill is out 8-2. And then next final item is item number 11, SB 1475 by Senator Glazier. Consultant, please call the roll of absent members.
Gonzalez. Grove.
Aye.
Grove, aye. Limon.
Okay. That bill is out 8-1.
Was 1361 pulled from the agenda?
1361? No. 1464 was pulled.
I don't
But
have a 13.
I don't have a 1361.
By Senator Kamlager. Why is this on my agenda?
Okay, yeah, there's no SB 1361. Okay, is there
Is
any?
there a 13? I don't have
No,
a 13.
no, I don't have one either. Okay. Okay. All right, with that, we've concluded the agenda of this hearing of the Senate Committee on Health. I want to thank all the individuals who participated in public testimony today. If you are not able to testify today, or if you wish to submit more comprehensive comments, please submit your comments or suggestions in writing to the Senate Committee on Health or visit our website. Your comments and suggestions are important to us, and we want to include your testimony in the official hearing records. Thank you. Appreciate your participation. Again, I want to thank all the staff. I want to thank the sergeants as well, and the technical staff as well for their assistance in making a smooth running hearing. We have concluded this agenda of this hearing of the Senate Committee on Health. This hearing is now adjourned. Thank you.